And at times she felt burned out by it. And it was really a full-time job. Diabetes is a full-time job. Being pregnant with diabetes is like an extra full-time job. And then you might also have a full-time job. So it can be really, really hard.
Pregnancy while living with type 1 diabetes is challenging. A group of clinicians and the women that live this experience received funding from the Women's Exchange 15K Challenge to see how we could improve the pregnancy journey. To do this, we partnered with Type 1 Diabetes Think Tank Network, who use patient narrative and specialized programming called Insight Sessions to bring people living with type 1 diabetes and healthcare professionals together to improve quality of care. This experience-based co-designed event identified areas of priority and offered solutions for improvement. A qualitative questionnaire was used to allow patient advisors to narrate their pregnancy experience across 5 stages: preparing for pregnancy, early pregnancy care, late pregnancy care, admission to hospital for delivery, and bringing baby home. Patients and providers then used this information to explore what they heard.
The first sort of emotion that we connected to was being told that she couldn't get pregnant because her A1C was not good enough. And it was just feeling a bit devastated, really.
There wasn't enough education given to women in the pre-pregnancy phase.
And then in early pregnancy, some words that jumped out to us was sort of sparse care.
Unexpectedly, the patient's experiences identified that traditional virtual care applications that focus on glycemic control may not improve the self-management support or pregnancy experience.
I wasn't able to be what they needed me to be.
She didn't feel like some of the nursing staff had a whole lot of knowledge in regards to how she should have her diabetes should be managed. And so she felt stressed, scared, sad.
Overall, it was felt that there was a lack of information on what women could expect with their diabetes while pregnant, a high expectation for women to have better diabetes control, but lacking the knowledge to know how to manage the stages of change. There was also desire to improve their diabetes management, get support with transitioning to new care teams, such as a tertiary care facility or programs that focus on high-risk pregnancy.
I think that one of the main issues here is definitely we have to try and eliminate this disconnect between what happens in clinic, what happens in the endo world, what happens in the patient world, and then what happens in reality in labor and delivery.
During the event, 2 virtual solutions were proposed. The first, an application that would provide anticipatory guidance, tips for self-management, and advocacy for healthcare teams through the pregnancy journey. Educational alerts would be delivered in the form of weekly emails or text messages. The second, an online peer-to-peer community where women with type 1 can connect and support each other. This platform would also provide access to healthcare experts that would act as moderators and provide evidence-informed advice where appropriate.
It's like ingenious, but common sense at the same time. Because I think if you don't feel alone, you feel empowered.
Understanding a women's experience will help us develop better prenatal education and communication with women and their families. Investigating and piloting remote programs that address these needs may create more positive pregnancy experiences and empower women with type 1 diabetes.